This patient was referred to me for endodontic retreatment of tooth number 7. The root canal was done about 5 years ago. Recently, patient started to have some symptoms, went and saw his dentist, and his dentist noted this periapical radiolucency, as you can see right there. So referred the patient to me. So we discuss options with the patient. I almost always like to do non-surgical endodontic retreatment first. And you know why? Because with surgical endodontic retreatment, you only address the apical few millimeters of the canal. But we know that there is microorganisms throughout the root canal. So if you only address this much of the canal contaminated with microorganisms, you leave the rest of the microorganisms behind. And over time, there is potential for reinfection, for the infection to come back. So I would like to treat the entire length of the root canal if it's possible. And in this case, I felt that was possible. So that's what we did today. So went through the PFM crown and removed the post. And this is it. This is the post right here. It was a pretty decent sized post. It gave me a kind of hard time. Didn't want to come out. But it took me about 7 to 10 minutes for it to come out, to remove it. I use ultrasonics. And here's the post-op. So remove the gutta percha, of course. I used chloroform, and the apical diameter was 60. So I placed an MTA plug and left the dentist some post space. And temporized the tooth. The good thing with MTA here is also, if you later on need to do an apical, it makes your life so much easier. So much easier. You don't have to retrofill anymore with MTA or whatever material that you prefer. But in this case, if we ever need to do an apical, all we need to do is go in and resect the apical few millimeters there, clean all of this out, and we don't need to retrofill because we already have MTA here. Makes the apical a lot easier. So that's why it's important to plan everything ahead of time. Just think about the possibilities and what would make your life easier if you ever need to do something, another procedure. So do that procedure to later on, if you ever need to do another procedure, it makes that procedure better, faster, more efficient for you and your patient.